India bears a disproportionately large burden of the world's tuberculosis cases. In fact, incidences of tuberculosis in this country account for over 25% of the global total. And 1,200 Indians are dying daily from the disease, which raises the question, are we truly on track to eliminate tuberculosis by the year 2025? And perhaps beyond that, how can we improve the burden, bridge the gap, and generate more positive patient outcomes when it comes to tuberculosis care? Well, these are a series of very complex questions, and they deserve to be approached from a 360-degree perspective. And fortunately, I'm joined by a highly distinguished panel of subject matter experts to help me do just that. Please allow me to introduce our guests. We have with us the Deputy Director General Tuberculosis, Central Tuberculosis Division, Dr. Rajendra Joshi. Regional Director, the Union Southeast Asia, International Union Against Tuberculosis and Lung Disease, the Union, Dr. K.S. Sachideva. Director, United States Agency for International Development, or USAID, India Health Office, Sangeeta Patel. And the Head of Sustainability and Corporate Social Responsibility at Apollo Tyres, Rinika Grover. Thank you so much for joining us. For us to eliminate TB as a country, the public sector alone cannot operate in isolation. So how can the public sector and the private sector better work in tandem to make this vision a reality?
To be frank, no government is capable of addressing all of these development challenges on its own. And from the USAID perspective, we recognize this not only in India, but also across the world. It's not a question of resources, but it's a question of commitment and a shared vision. And I think that what we want to at least understand, even in over 10 years of work through USAID with the private sector, it's that oftentimes we start with pilots and we start to think about how we can go to scale. And unless that partnership and that vision is co-created from the government of India's perspective, as well as the private sector's perspective, in a shared vision, then I don't think that we'll be able to accelerate and actually attain the goals that we set out. I think that's why it's very important to have these shared goals and visions, particularly when we know that in India, there's a large proportion of the population, whether it's from the perspective of being low income, marginalized, or simply vulnerable, that we have to reach out to together. And I think this is part of the reason why USAID certainly prioritized TB and prevention and especially care within the workplace. Right. That's why we decided to work especially with the corporate sector to figure out ways that we could certainly involve them in the corporate TB pledge along with the government of India to really be able to create that workplace enabling environment, especially because if people are more productive and certainly if they have more economic access, they'll be able to return that investment in their family.
And that makes for a great segue into my next question, which is to you, Rinika, because unfortunately, when it comes to TB, some of the most marginalized subsects of the population are generally at the highest risk, namely migrant labor, for example, in our country. So what inroads has Apollo Tyres made with respect to easing the TB burden, specifically within sort of the four walls of your community?
Before I kind of answer that question, it's very, very important why we're working. So we're working in the truck driver segment. We have healthcare services across India. Right. And the reason we chose that as one of our target population was because, of course, they're one of our biggest key customers. So it just made business sense for us to start working in the healthcare segment. But what kind of backed up with that is various kind of studies which are out there, which say one was recently, which said about 50% of the drivers have some kind of medical conditions for their need of health services. Yeah. So when we just started back in 2000, which was just HIV awareness and prevention. And slowly, gradually, from one center, when we started, we moved on to about 32 healthcare centers across India in the 19 states. But the key point was that these healthcare centers have to be based out of the transshipment hubs because that's where it makes it accessible for the drivers. So we started with HIV, then we looked at various other emerging health conditions which the drivers were experiencing. So it started with vision care, then non-communicable diseases. Tuberculosis was one of the things where we introduced in 2017 which is a co-infection with HIV. So it started with awareness raising. Then the second thing, which was very critical at that moment in time, was to provide them with testing services. So we had fostered, because we'd already been working with the government in this space. So of course it was a new emerging condition, health condition. So we fostered partnerships with the government, and then we opened DMCs, which is a designated microscopic centers, for testing services as well. Other thing, the third point was we needed to provide medication as well. So we again partnered with the government, and we provided DOT facility through our healthcare centers, making full use of what we already had, the infrastructure at all the locations. But one critical thing is, when a beneficiary is availing a service, very importantly, they have to have a good nutritious diet as well. That absolutely goes hand in hand. It's complementary. So there is no way that you can actually completely disregard that. So we, with the support of the government and our partners, we have actually, through the Next Share ID, we have actually helped our beneficiaries to avail that, scheme where they can get monetary benefits for nutritious support as well. One thing more, I just wanted to highlight, our service, the work is not just limited to the truck drivers community. What we've done is we've taken the awareness raising part to the communities around our manufacturing locations as well.
And all of this is very heartening to hear, and it sort of takes me back to what Sangeeta said earlier in the conversation, which is more than resources, it's about a shared commitment and vision, and that seems to really ring through here. So I applaud you for all your efforts. And, building on that, I'll come back to you, Dr. Joshi, and I want to weave the pandemic back into the conversation, because the government certainly leveraged the power of partnership in the wake of the COVID-19 outbreak and the subsequent waves that followed. So does the government intend to follow a similar strategy for TB? Walk us through what the government's envisioning, how it intends to amplify investment in this direction, and potential future partnerships in the pipeline, sir.
See, earlier we had many corporates who were willing to work. They wanted to support the system, but they didn't know what to do. So this concept of corporate TB pledge, we have got different stages, right from starting, create awareness, commit yourself. Not much money is involved. Then second point, it's actually a fact that tuberculosis is not just one person's disease.
Right.
It has got huge economic sense for the employer, whether it is absency, whether it is the stigma. And secondly, it is an infective disease where if it is detected in time, I'm not only helping the person, but I'm also protecting the co-workers who work close together. So it makes huge economic sense. And the other factor is, now it is multisectoral. We have to involve the community. We have to involve all factors. Like another thing is, like right now, this media Times Network is doing this. That itself is a big support for us, because creating awareness is one of the major things where media can contribute. There is one more thing that was again brought out, that about the stigma. Right. The person with TB should not feel isolated, should not feel neglected, should not feel stigmatized. Right. So again, the employers and others can definitely help in that direction. That will again go out away. If I got a heart problem, I will openly tell it to everybody. But if I get tuberculosis, I may suppress it. Log kya kahenge? Mera beti ka shaadi hoga kya? All those are still in the society, even in this information age. So we have to come out of the shell. We have to tell the scientific facts. So there are a lot of ways people can help us, and everybody can help. It is not just employer, it is not the rich. I want to see everybody, whether it is our leaders like Sarpanch, corporates, or the employer or the employee.
Right. Everyone needs to play their part. And with that, I'd like to bring you in, Sangeeta, because I'd love your take on how USAID is eyeing India's target of 2025 from an achievability perspective, from a feasibility perspective. Do they consider it to be realistic now? Your take.
I think now, though, more than ever, with Prime Minister Modi's vision, we want to see not only success here, but we also want to see that it's a shared partnership, that if we succeed together. And if we fail, we redouble our efforts. But frankly speaking, we cannot, with humility, simply not try even harder in the face of COVID. Otherwise, we're already lost before we even begin. That's why I applaud the boldness, and frankly speaking, I look to India to be that leader, not only here, but for the region. Because I believe that if we can do it here, and India can model, especially in their partnerships with the private sector, in their workplace prevention, and even in their innovative solutions, whether it's adherence, treatment, care, support, even in the face of COVID. If we can master and tackle those challenges together, then honestly, it will be a model, not only here, but for the region and world. So I look forward to it.
Sangeeta, some very inspiring words there, and I'd love to bring Rinika into the conversation at this time. And let's, Rinika, perhaps zoom in on this year's World Tuberculosis Day theme, which is Invest to End TB, Save Lives. And it seems to be especially appropriate given that the majority of TB patients fall in this, working age group, the productivity age group of 16 to 60 years of age. So what more can the corporate sector do to reinvigorate its efforts in this direction?
One side everybody knows is the CSR funds, which we've been talking about. But the most important thing is to look beyond that, which is look inwards, because it's a huge piece of work which is not possible either by the government or by civil societies on their own. So with regards to corporates, one essential element is to look inwards to maybe, create awareness amongst their employees as well, because that's one of the key areas. Creating awareness among the employees and not just looking at your own organization, but looking at the entire value chain. The other piece of work which the panelists have been talking about is the corporate TB pledge. Pardon me. So when we're moving towards corporate TB pledge, it's also essential to get other corporate partners to come on board, because it's not, again, that you're working on your own. And it's not silo working. It's never been, never proven well. So that's one of the reasons you had the SDG 17, because if the SDG 17 talks about partnership goals. To reach the other SDGs, you have to foster partnerships. You have to work in collaboration.
It's time for a short break, but our TB Day special continues on the other side. So be right back. Dr. Sachadeva, Rinika just alluded to collaboration and partnership efforts. And so my next question, building on that, is to you, because mobilizing civil society on the one hand is no small feat, and then orchestrating meaningful corporate response is likewise tall order. So many people are looking to the union to connect the dots between the two. How do you intend to do so, sir?
TB is a very, very technical area. The supply side is difficult. The demand side is where you raise awareness, etc. There is a skill set which is available with many civil society organizations, many other experts, which is advocacy, communication, people with marketing skills, people with skills in coordination, etc. But there is a supply side where we need people who can deliver you on, say, TB vaccines, deliver you on TB preventive therapy. They deliver you on how do you do a population level screening, how do you design active TB program, how do you design the more complex technical things. Right. So we need to get now organizations onboarded to be learning these skills, and then approaching Dr. Joshi, what he calls as patient provider support agencies in various districts, to ask him for money to support him, and he's more than willing to support them. TB space is typically, we are a set of few people. You will always find myself, Dr. Joshi, and Sangeeta Patel, and Ritika, yourself, always on most of the panels. We need to expand this group.
We do.
Yeah, the group is very small. Similarly, the civil society group is very small. We need to expand this group. We have started looking out at organization in the education space, in the other space, in the reproductive and child health space, to at least capacitate them on the TB side. It's a difficult, complex technical area. It's not a physiology like pregnancy and thing, which is more of a physiological phenomenon. So here things are a little difficult. Drug-resistant TB is another different animal altogether. So we need to capacitate and then deliver services.
Well, Dr. Joshi, I'd like to switch gears a bit here. Yes, sir. And so, yes, sir. I do want to switch gears here, though, because I wanted to sort of take the conversation towards the softer side. And Dr. Joshi, I'll come to you for that, because in countless scenarios, the scale of treatment or the cost of treatment, or perhaps simply the stigma of being labeled as a TB patient keeps one from reaching out for support from friends, family, peers, or medical professionals for that matter. So what's the solution? This is a definite tough nut to crack, sir.
I think one of the very, very important aspects you have brought out, and very thankful to you for bringing it out. See, recently we had a survey where we found out that the health-seeking behavior of the patient itself is very low when it comes to tuberculosis.
Right.
Second component is the stigma. So, for example, we know what are the common symptoms of tuberculosis: cough more than 2 weeks, weight loss, blood in the sputum. We have a set of it which is well established. We have got a lot of doing awareness campaigns. But believe it or not, huge number of people do not come to a doctor even though they have got all the symptoms. It is not public, not even they don't go to a private doctor also. They have the symptoms, they either ignore it. We have got studies done in India. They either ignore it or they go to some traditional person who doesn't suspect or who doesn't have the wherewithal to diagnose tuberculosis, and these patients suffer and they also spread. Second aspect is, once we diagnose, the stigma is there. So they don't want to tell anybody, they don't want to tell the workplace, employer, or the school teacher if the child is having.
Right.
All those things. So in both places we require, like Sadhya sir said, we require a huge amount of lot of work to be done. Then we have got other programmatic interventions like active case finding, where we go to the community and try to screen everybody. And corporates can also do it. All they have to do is give a simple questionnaire in the local language and just ask, "Aapko ye sab hai kya?" or any of them. And if it is there, guide them to the nearest center. The rest part will take care.
Right.
See, by just providing free diagnostic, free treatment, we don't cure the thing. People should come, or we should go to their house. There are only two ways. And corporates can definitely help here.
Well, Dr. Sachdeva, I'll come to you. And I want to sort of delve into the perspective of the patients there. Because as the disease continues to progress, of course, the prognosis deteriorates. And in so many unfortunate scenarios, the patient is approaching their doctor or a medical professional when the disease has progressed well beyond a curable stage. So, sir, given that, do you believe that TB awareness campaigns have truly made meaningful headway? And how does the messaging need to be revisited, sir?
So, Pooja, again with TB awareness campaigns, we are guided by evidence. So, the revised version of the program started somewhere in 1997, and we are in now 2022, so it's almost 2.5 decades.
Right.
In 2.5 decades, they have had 5 KAP surveys, knowledge attitude practices surveys. And if you look at the results of the 5 KAP surveys, you will see that the awareness about how TB is caused, how it spreads, how it is treated is very good.
Okay.
The stigma part, if you see, is on the decline, but it's not declining very steeply also. Now what the program again is concentrating is on patient-centered care. What you are talking about is where you actually approach each and every patient, community member, their family from their own context and their own lens. But then you need a huge skill set down there in the field, because India is a vast geography, vast country. There are cultural context varies every 50 kilometers. You travel 50 kilometers and your cultural context and your understanding will change. So it's a very, very difficult job, but people are doing it, and the patient-centered care has captured the fancy of all of us. Many organizations working with TB, working with us, working with Sangeeta are now focusing on patient-centered care. They are sort of voice of the community. They are voice of the patients. They are, and the TB champions or the TB mentors is an output of that. They have done so much advocacy that the program has been forced to invest in sort of upskilling capacitating those community members and former TB patients to be advocates for TB, holding hands with other TB patients, other communities. So the beginning is already there. Much of the example is also drawn from the HIV program. They also did the same. And this is what has also started happening within the TB field. Give it another few years and you will see a lot of civil society actually supporting program with resources. So again, initially you need a catalyst. Sangeeta is there, the Global Fund is there. These catalysts show you the way forward. A word on your TB elimination, I wanted to say. If you look at the various literature, you will read that TB is almost 20,000 years old. In past 20,000 years, we never thought of eliminating TB. If somebody is thinking of eliminating TB, meaning thereby there is enough scientific material, there is enough ammunition, and there is enough sufficient capacity, will, and resources available in the hands of policymakers and its supporters to take you there. So let's not doubt that.
Let's not. And that actually brings me to my very last question. And by way of closing comments, I'd like to pose this to all of the panelists, and I'll start with you, Rinika, because in certain circles, whether justified or not, India has been coined as a TB capital. So when can we begin to turn the corner on this trend? And can we expect to see TB-free generations in the near future? Your take, very quickly.
One thing is very, very critical over here is to look at, because I touched upon that too, which is to look at joining and signing. And I really urge everybody to join the corporate TB pledge, because even if you do not have the resources to look outside, but at least you can look inside within your organization where the awareness levels can be increased. Because one thing this country needs is awareness levels. One thing this country needs is, of course, the medical infrastructure so that it doesn't turn to be a MDR. But that's where we start. So to answer your question, I don't see that there's going to be a challenge in terms of achieving the elimination target as long as we work in collaborative models with a shared vision.
Sangeeta, what's your take?
I'd have to agree. I mean, to be very frank, with a prime minister who's really come out to the world with the bold goal of eliminating TB, and also with Modi's vision as well, to really be able to promote the integration even of TB within areas such as Ayushman Bharat. I can see only, at least over the next few years, a united efforts to really be able to make that a reality, way ahead of the UN goals, at least for TB elimination by 2030.
Dr. Joshi, do you echo the same sentiment, sir?
Exactly. The tuberculosis is an infectious disease, and I'm very sure if all of us join together, we can definitely achieve the goal.
Dr. Sachadev, I'll give you the last word, sir.
Pooja, I want to give two counter narratives. One, we are not the TB capital. TB elimination is a bigger goal. It's a bigger goal. So if we are able to eliminate TB or be close to elimination or achieve sustainable development goals by 2025, we are there. Our generations will be TB free.
Well, I believe that makes for a wonderful note upon which to close. With that, our Tuberculosis Day special comes to a close. And I believe I speak for everyone in saying that perhaps a long journey lies ahead with respect to eliminating TB in this country. But conversations like this certainly make for a critical first step. So thank you so much for joining us, and we trust you found the insights shared of that. Thanks for watching.